us into consideration.
All right.
We can work the thing together.
All right. Now go run now. Now grab a card there. Here. So, but thanks for the contribution to the program. Much appreciated, and I'll be in touch.
All right, Mr. Ratty. I'm blessed up yourself. I'm blessed up all the listeners and the viewers.
All right. Take care now. Yes, people, some concerned citizens out of Jamaica talk up the things, you know. Caller, good night. Welcome to A Reason with Rattigan. Oh, sorry.
Yes,
Welcome
sir.
to Come Reason with Rattigan. Where are you calling from?
I'm Jamaican. I'm actually in Florida right now, but I still have my house in Jamaica. I have business in Jamaica.
All right. Talk to us, sir. Good evening. Good night. How are you?
Yeah, and one of the reasons why I'm here in Florida right now, I can hear the frustration in that gentleman's voice and the lady's voice. I had two incidents in which where they caused me to actually leave. And I know that people say you hear this thing, but when you have the experience with it, that's a different thing. 2 years ago, my daughter, who is a HR manager, has just changed her job.
Mm-hmm.
She ended up in the university hospital late one Sunday night, early Monday morning.
Mm-hmm.
She was diagnosed with appendicitis, so acute that the doctor said she needed immediate emergency surgery. At 6 o'clock in the morning, she was on a bed in the corridor at the university hospital. 12 o'clock Monday, she was still on a bed in the emergency, in the corridor. So they're waiting on a bed. 6 o'clock the evening was Monday evening. She was still in the corridor. She got a bed something to 7 Monday night. I want to follow the timeline.
Mm-hmm.
12 o'clock when we asked when the surgery is going to be done, nobody could give us an answer. 6 o'clock Tuesday morning, same thing. 10 o'clock, same thing. 12 o'clock Tuesday in the day, same thing. We actually went over to the private ward, which is the runaway tweets, which is the private ward of the university hospital, to inquire if they have a bed. They said yes, but they cannot admit her because the doctor who is doing the surgery will have to be attached to the hospital or has special permission to do surgery in the hospital. We subsequently started calling the private hospitals. We found one. We went back and said, okay, we need to have her discharged. They told us we have to wait for the doctor to come and write the discharge. I said, when is she coming? Nobody could tell us. So it's about something to 3, because we have a number of doctors and nurses in the family. My mom, who had done almost 60 years in the health sector in Jamaica as a nurse. And one of them was there and they decided to take out the drip and all of that stuff. And I said, I'll keep this to take her to the hospital. We have to call an ambulance, $35,000. When we get to the hospital in the chair, as I said, she's a HR manager, she has just changed her job. She was in the 2nd month of her job, so nothing, no benefits was start kicking in as yet. So no health insurance or anything at all. They said, do you have insurance? We said no. They said you have to make a deposit of $100,000, which we did. After that, they said the surgeon is going to come to do the surgery. You have to make a deposit of $250,000, which we did. The surgery was done at about something to 10 Tuesday night. She spent 3 days in the hospital. The first 2 family members who weren't crying were praying because she was unconscious for those 2 days. When she came to her, we talked to her and she started asking. 3 times she asked what date was, and we tell her to start crying and said, I could have died if you would have told because of my family, because of you guys. And the doctor then, after we spoke to the doctor later, he said, if we had waited 3 or 4 more hours, she probably would have died because it was about to rupture. When she was about to be discharged, on the 3rd, after this, she spent 3 days, and we're in the hospital room, they actually carried the bill right there, giving it to us. And Mr. Rattigan, that bill cost $1.8 million. Right? And I keep saying to people, if you are sick in Jamaica, you have an emergency and you don't have the money, you're dead. you're going to die. And to add insult to injury, 3 weeks after she was discharged, they sent us an additional bill for $25,000, which I shredded and called them and I tell you, behave badly. I tell them, sue me. I'm not paying it, right? And that was one of the reasons why I decided to say, no, I can't do with this thing. And I'm a qualified teacher. I have a bachelor's degree in marketing. I have a master's degree in criminal justice. I have a PhD in business administration. So I could have contributed to the society in more than one ways, individually or collectively. Even my mom, she was sick. She went to the Black River Hospital. They say she needs to do a test. The machine to the test was not available. You have to transfer her to the Savannah Hospital. My mom was 96 years old. When they do the test, they say she had bowel obstruction. She had to do surgery. It could not be done at Black River Hospital. It had to be done in Mandeville or Kingston. One of my nephew, who is a doctor at the University Hospital, and my daughter, who had that issue early on, was in Kingston, lives in Kingston. So we let her do it in Kingston so everybody can look after her and check up on her. My daughter normally go to check her after the surgery in the mornings before she go to work and after in the afternoons. That particular day, she had a meeting because she's a part of the negotiating team with a union at her job. So she went to the meeting and then went up there. The time I was here, she called me and she said, Daddy, I didn't want to tell you this, but I went to visit grandma and I was upset. That was when she was telling me that previously she went there, and because she did the surgery and they had this bag on her side, and the thing that they had to attach the bag to keep it was scratching and she pulling it off. She said, when I wanted to go there, she was a mess. And when she talked to them, they had attitude. So in that particular day when she went up there, this nurse was feeding her. And she can't eat anything that is solid. And because she had the bag at her side and stuff. And she just pushed the thing down her throat, not even waiting for her to swallow it. It was running back all out of her mouth. And she said, Carl, I said, what no? Why are you treating her like that? When she said to her, Grandma, have you taken your medication? She said, no. She said, what time did you take it this morning? That she did not get any this morning. She said, my daughter said when she checked, she had not gotten any medication for more than a day. And she just did surgery a couple of days ago. And when they keep asking where are the medication, nobody know. They have to be running the patch. She said it take about half an hour. In some closet or the other, they found it. So she called my nephew, the doctor, and they had to talk to the administrator of the hospital. So we have to end up having a caregiver during the day for her to make sure she's clean, she eats, she's fed properly, that she gets her medication. And even after that, we found out that she had to do another surgery 3 weeks after because whatever they did earlier, when it wasn't complete, it was wrong. And that is the state of the health situation in Jamaica.
All right, you have a message. You have a message for whoever is going to be the next Minister of Health and Wellness. You have a message for that person.
Well, all I'm saying, Mr. Ratican, is that a lot of people in that country, because of the health situation, are suffering. People are dying. Children are dying. Mothers are dying. You need put emphasis on certain areas, and one of them as a priority is health. If you don't have health and the people are not healthy, they can't help to take the country forward economically or otherwise.
Mm-hmm.
So areas where you're putting your priority in, you need to rethink and think about the critical areas like health and education that can help to put the country forward.
All right.
Because this is very unacceptable and it is very disturbing, frustrating for people who are sick and cannot afford to pay a private hospital or a private place to do tests or anything. and they're contributing to the society and paying their taxes.
All right. All right. Well, I hear you, sympathize with you, and we have to galvanize the people, not just in Jamaica, but outside of Jamaica.
Yes, Mr. Green, I love my country because
Mm.
even I'm here, I still have my house in Jamaica.
Right. No, I understand.
I have a business, a part-time sharing a business in Jamaica.
Right.
So I am, yes, I tell you, I am aligned to a particular party, but I'm Jamaican.
Right.
And that's first and foremost for me, Jamaican.
Okay.
And my people. And the people who are suffering down there. That's me.
All right. Well, let's keep the conversation going now. So continue to support the program and continue to express your views, because that's the only way things will change. You can't keep things to yourself, you know. And by the way, go and sign and sign it.
I've been saying to other people, I said, your program and some other programs, I have to lift my hat and give you, because amount of stuff that I personally and others have learned that we didn't know about, that was happening and is still happening. And enlightenment of what is taking place and some of the stuff that is going on, the corruption and all that stuff that is going on there.
Right.
As long as I have breath in my body, I will continue to support and embrace your program and others like you.
All right.